Welcome to Powered by Authenticity and episode 3 of our special Western New York Changemakers series. You know what we're talking about, those in Western New York who are making a difference in our community. You may not know them as a household name just yet, but I promise after tonight's episode, you are going to want to get to know more about Helana Shumway, the Public Relations Coordinator for Breast Cancer Coalition. Absolutely amazing. Helana, welcome to the show.
Thank you so much. I'm really honored to be here.
I appreciate you coming, and you get to be in our studio with us.
It's very exciting. It's very cool.
Well, welcome. Would you like to tell us a little bit about yourself?
Sure, yeah. I am Helana Shumway. I'm from the Rochester area, born and raised. I went to Honey Falls, Lima through elementary school, and then middle and high school. I was at the Harley School, where I met my good friend Ken. And then after that, I went to undergrad in Madison, New Jersey, a small liberal arts college, Drew University, and I studied Spanish and a bit of psychology. During college, I studied abroad a lot for my degree in Spanish-speaking countries, which was really, really fruitful, and I really enjoyed that experience a lot. After I graduated, I was an au pair or a nanny for a few months in Spain, and then ended up going back to get my master's in social work at NYU, and was a social worker for a few years, and then as I think was maybe a common experience for many of us during the pandemic, I moved back home and kind of reevaluated what I was hoping to do long term. And at the heart of it all, I do feel like a social worker, but I'm really more interested at working on the community level, the organizational level. During that time, I was also starting freelance writing, which I still do. And this opportunity presented at the Breast Cancer Coalition in Rochester, New York, which was a really kind of perfect blend of writing, communications, and community outreach. And so I've been there since the end of 2023, and I really love it. I'm more recently the public relations coordinator, and so do a lot of the written communications and our quarterly newsletter, Voices of the Ribbon, which is a free publication that we distribute throughout Monroe County and beyond in our region. So that's kind of me in a nutshell, I guess.
That's amazing. Yeah, and I actually get that quarterly newsletter.
Oh, good. I'm so glad to hear that.
I do. Now, we also used to know Holly Anderson, who worked there. Well, we still know Holly. Yes. I didn't mean to make it sound like that.
Sure.
But yeah, so she was the executive director. She's since retired?
Yeah, so yes, she was there for 23 years. Holly was she was a one-woman show when they first started, the first employee, and then she really grew the organization to be such a fruitful and successful organization and nonprofit. And just, anyone who knows Holly, she is amazing and a go-getter and such a powerful, influential, helpful person who's really looking at supporting breast and gynecologic cancer survivors. I was lucky to work with her for about 6 months during my time. And then she, quote unquote, retired, but she's still very active in the policy world. And now we have her, Christina Thompson is our executive director, who's also really fantastic and wonderful to work with. So it's been a really enjoyable experience.
So some amazing powerhouses that you get to work with.
Yes, it's a pretty cool environment. We're doing a lot of work. Each of us has a role, and we share parts and make it, something to really uplift our community is our goal, I think.
Yeah, awesome. Yeah. Well, thank you. What a great background. And all right, so we like to do a little icebreaker.
I love it. Yeah.
All right, keeping with our Western New York theme for these series, what is a favorite restaurant, coffee shop, something like that in Rochester that you love to go to?
Yes. So I am vegan, which is, something that in Rochester, I don't have a difficult time at all finding good places to eat. One of my favorite places is the Owl House in Rochester, which is not a fully vegan restaurant, but they offer a lot for every kind of dietary preference or need. And so they're in like an old house on Marshall Street and just have delicious food, and there's something for everyone there. So I love that. And then coffee shop, I really love Fuego.
Where's this?
That is near Jiva, right on Woodbury, and they have fantastic coffee, and they're just so nice, and it's a great place to go do some work or just kind of chat, and the staff or the team there, they're also nice.
Oh, that's awesome. I never heard of that coffee shop, but I'm going to go check it out.
Yes, I recommend for sure.
Oh, awesome. All right, producer Ken, how's it going tonight?
It's going good.
All right, so I think you graduated with our guest.
Indeed, yeah.
2012, you guys?
That's it.
All right.
A little bit now.
Yeah.
Perhaps. Yeah.
All right, what's your favorite place in Rochester that you like to go to?
Oh, I'm a big fan of California Roll and Sushi up on the lake. Used to have the place in Village Gate, but they've since closed.
Yep.
So there's that. Coffee shop, love Finger Lakes. I've been to Fuego a couple times, actually.
Yeah.
Place I used to work, we did some of their coffee in one of the locations.
Yeah.
Yeah.
Oh.
I think I was at their shop before they moved into the one that they're at now.
Yes.
Because they were a little closer to the university at one point, if I
Okay.
remember correctly.
Okay. All right. Yeah.
All right, well, I guess you kept that one a secret and hidden from me. Thanks, buddy.
There's Joe Bean. There's a bunch of them.
Yeah. So good. So good.
I like Finger Lakes. I love to
Yeah.
go into Finger Lakes Roasters, and
So good in there.
it's so good in there. I just love it, and I'm not sure if I have a favorite restaurant anymore. A couple of the ones that I loved in Rochester have closed, like Daisy Flour Mill. A couple of the others that were amazing, but I do like Rohrbox. That's good too.
Yeah.
So
Daisy Flour Mill is now a brewery, actually.
oh,
Right at the bottom, Ellison Park area. That's where it is. Yep.
Is that Rising Storm now? Is that what it's called?
I can't remember what the name of it is, but
Okay.
went in a couple months ago,
Oh, okay.
oh yeah, you
back
did
in March.
mention that.
Yeah.
All right. Well, cool. All right. Well, I learned something. Thank you for sharing. We like to get to know a little bit about these things. All right. So, can you tell us a little bit more about the Breast Cancer Coalition?
Yeah, I'd be happy to. So we're in our 27th year, and it really started, I think it was 1997, 1998, when a group of women, breast cancer survivors, were sitting around a kitchen table, and they had recently come back from a trip to Washington, D.C., and in terms of looking to advocate for survivors in our community. And they really realized there was a need for support, education, and advocacy for anyone who has been impacted by breast cancer. And then it grew into an organization when Holly was the executive director. It's really started to grow and blossom. Today, we serve 27 counties in western and central New York. And basically, we serve anyone who has received a breast or gynecologic cancer diagnosis. We've been serving GYN cancer survivors this is our 11th year doing so now. So whether someone, received a diagnosis today or they're 10 plus years out from their diagnosis or from treatment, whatever it might be, they are always welcome. Our programs are all free of charge, every single thing. And we have a mix of in-person, virtual, hybrid, discussion groups. We also have a healing arts initiative, so classes like yoga, tai chi, qigong,
Amazing.
meditation, which have been, really proven to really be helpful in overall well-being and care. Our 4 pillars of service are support, which I just discussed, education. So we offer lots of evening webinars, which are free and open to the public on a monthly basis. Research is our 3rd pillar. We don't do research ourselves, but fund it. Fund regional researchers within New York State. To date, over soon to be over $1.2 million since 2003 in seed grants for those researching specifically breast cancer in terms of prevention, prevention of metastasis, cause, treatment, and such. And the hope is to open that up soon to gynecologic cancer research as well. And our final pillar is advocacy, and we have a very robust advocacy committee. I recently became one of the co-chairs, so I'm very much learning as I go. But it's really looking at local, state, and federal legislation that directly impacts our survivor community. And I'm happy to get into that more at a later point if you'd like.
Yeah. Oh, that's amazing. So, and I'm not sure people realize that there's so much that's available without cost.
Yes. I think that's one of the biggest things that I've come to really appreciate and admire about the organization is that's the last thing that someone should be forced to worry about when they are in the midst of receiving, life-changing news and they're looking for support. We also have a wonderful peer mentorship program, which is really empowering. And so, money is never even a barrier to accessing our care at any time, our services, and we're always available at any point.
So just curious, so if somebody were to receive a cancer diagnosis, they could basically reach out to you guys, and you could even help to have them understand what the right or support treatment plans and just somebody to talk to and understand it?
Yes, absolutely. So we certainly are not medical professionals and don't give any medical advice. Oftentimes an individual will be referred from their medical provider after getting a diagnosis. They often get, a packet of resources and information and are encouraged to reach out to us. And oftentimes they'll come in for a breast cancer or gynecologic cancer 101 session where they'll meet with our programs department and our executive director, Christina Thompson, to really talk about, where they're at. Are they discussing, certain treatment options? Are they looking for second opinions? Are they considering a type of surgery? And what are their needs? Do they have, financial concerns? There are different organizations like Embrace Your Sisters that offer financial support and Sustain, Inspire, Survive, I think is the other one that it's called. Apologize if I'm...
No, you're good.
But so really, to really be holistic and encompassing in terms of what they really need. And oftentimes after that, they'll then get matched with a PAL or a peer advocate lending support to really offer lived experience for someone who's a bit farther down the journey. And those matches are made very intentionally based on perhaps the subtype of breast cancer, the stage in which it was diagnosed, the time at which someone received their diagnosis. Do they have young kids? Are they working? Are they retired? Have they gone through a divorce? Whatever that is, to really try to be intentional with matching that so that someone can have someone to talk to who gets it as much as one can get it.
Yeah, I love that you're looking at the person as a whole, like not just the diagnosis, but that person as a whole and helping to match them with somebody who's really going to be able to resonate with what they may need.
Yes, absolutely. I think that's a big thing for us is that it's a holistic approach, and I have such admiration for our programs staff, including our executive director, Christina. Many of our of the team are breast cancer survivors, so they come with lived experience and empathy and compassion to caring for those who are walking through those doors for the first time, and understandably so. It can be very scary, and the unknown can be terrifying. To have a safe place to land is really important.
Yeah. Oh, what a beautiful place in our community. And now tell me about your role. So what's a day-to-day for you in your role?
Yeah, that's a great question. So when I started back in, I think it was November 2023, I started more in a community outreach position. I was also working with community-based fundraisers, so third-party fundraisers. That's another thing I will say is that every dollar raised stays local for the organization, which we really are proud of, and knowing that someone who does donate or contribute, you're directly impacting your community, which is really wonderful. But so I was doing that for a while, and I had begun to do some communications as well. And then at the beginning of this year, I transitioned to the more public relations side of things, and the written communications. Unfortunately, we did have a very dear member of our team whose name was Pat Battaglia. She was the editor of the newsletter and the associate director of communications, and one of the most beautiful people I think you could ever possibly meet. She had been living with metastatic breast cancer for several years, and unfortunately passed away back in February, and she had to retire at the end of last year due to her disease progression. She was a huge mentor for me, and we worked very closely together along with our director of communications, Deb, who's really incredible. Pat really made this Voices of the Ribbon newsletter, which is a 32-page magazine, essentially, what it is today. And so I have tried my best to continue to support that. And I love to write, so that's been really beautiful, and try to honor all that she did, and certainly not replicate, because it will never be the same, but knowing that her voice and her legacy continue on is really important to all of us.
Oh, that's so sweet. Oh my gosh, I actually feel like I might cry.
She's really, really lovely.
And what a beautiful thing for you to understand that, it may not be the same, but you're really recognizing the work and the foundation that she laid.
Yeah, yeah. She was a wonderful, wonderful person.
Oh, that's so great. It's got to be so interesting to work with so many survivors of the disease, and just see how talk about walking into a place where you need to feel welcome. Like that's really got to resonate. And
yes, I think so. And, I myself am not a survivor, but, I quickly came to realize that what I thought I knew about breast cancer or cancer in general, it really wasn't what it is. I certainly am learning every day, and by no means have any sort of medical background, research experience, whatever you want to call it. But it's really amazing what the participants or the survivors, these women, vast majority who are women coming in, what they live through and with every day, of course, in different stages in the disease. But I think at the heart of it is just knowing that they do have a place to come and to connect with other people, to get their questions answered. And if we can't answer the questions, we connect them with somebody who can. Yeah. And I think just being seen and supportive wherever we can. And sometimes those discussion groups, especially our Common Ground group, which is for those living with metastatic stage 4 breast or gynecologic cancer, it's a really beautiful group that comes together weekly for lunch and to talk. We have our brown bags on Fridays for everyone. I mean, it's just it's quite real, of course. There are losses, and that's very hard. And at the same time, there's a lot of joy and a lot of hope that's instilled.
Oh, amazing! Yeah. What amazing work! And I'm curious, how does that help to equate to outcomes for our community? So having a place where there is a holistic view of somebody, and a place where they can come and be with others. So what do you think a community organization like the Breast Cancer Coalition, what do you think that brings to the patients?
I think it brings a human level to it, a human touch, I guess, if you will. We are so fortunate in our region to have all of the medical facilities and institutions and hospitals. We work very, have great relationships with University of Rochester Medical Center, Rochester Regional Health, Roswell, Upstate Medical. We're so fortunate to be in such an enriched area in terms of the medical care that we do have in this community. What I think I've heard a lot is that it's just the human connection, and especially our PALS program, having that peer mentorship aspect. And there are people who have been coming for 10, 15 years. Oftentimes, an individual or a participant, a survivor, once they've gotten through their initial treatment, or once they've been at the coalition for a few months, whatever it might be, they often want to get more involved in our advocacy committee or our research, or want to volunteer at all of our different outreach events. There are definitely ways to kind of measure the number of people that we reach. I believe it's several thousand people every year. But I think it's more, at least from my perspective, it's more qualitative than quantitative in a sense, because you can't necessarily put a number on what it means to be able to come in and break down if you need to break down, or cheer because you've just had a really great scan and things are stable right now, or you've just finished your last round of radiation or chemotherapy, and we're there to cheer and be there for everyone.
I love that. You mentioned events. How many events do you do a year?
Yeah, so we have the coalition itself. We hold 3 events every year. The Pink and Teal Challenge, which we just recently completed, had over 1,600 participants walk and run at Monroe Community College. It's always every Mother's Day weekend, the Saturday before Mother's Day. That's our biggest fundraiser of the year, and it's in large part because of the peer-to-peer fundraising aspect with that. It's just a beautiful, beautiful day. Then we have a golf tournament in July called Teed Off at Breast Cancer.
Nice.
And so if you're a golfer, good for you. I admire you. I'm not a golfer, but a lot of people get really into that. And then we have our October, which is kind of like a gala, informal gala of sorts in October. And it's about taking action, and awareness is not enough for us. We really are big on taking action and trying to see change happen. And so those are our 3 biggest annual fundraisers that our director of special events, Meredith, and Lisa, also in the team, put together, and it's just absolutely incredible. And then we have hundreds of third-party fundraisers every year. And that was really amazing to see as when I was in that role, particularly during September for Gynecologic Cancers Awareness Month and October for Breast Cancer Awareness Month. The community is just so supportive of our organization. And, the statistic is 1 in 8 women in the United States will be diagnosed with breast cancer in their lifetime. It's nearly impossible, unfortunately, to not know someone who has been touched by this personally. So, our hope is to someday be able to close our doors and go out of business thanks to, a cure. Until then, we are so grateful for our community support that does funnel right back into our local survivor community.
Yep, that's amazing. Yeah. Ken and I helped at Batavia Downs.
Yes.
A couple of years, 2 years ago, producer Ken? Yeah. It was about 2 years ago. It was fun.
Yes. And I was fortunate enough to go last year, and it's quite an extravaganza, an event that they put on. And we were actually just talking today about the upcoming one for this year. So we're just grateful for their continued support as well. And it's simply because of fundraisers like Batavia Downs and also like, kids who do lemonade stands and donate $100, and everything in between that. We have longtime supporters such as Van Bortle, Salvatore's, and Leonard's Express. I mean, we're so fortunate to have such a strong community of supporters, of organizations, businesses, individuals, groups, schools, the students with their sports activities. I mean, we're very blessed in that regard.
Amazing. And just, the most amazing part is that every dime of that stays in our community.
Yes.
Which is, we're really fortunate that you guys are able to do that.
And we're very transparent about that. When you make a donation to the Breast Cancer Coalition, you know where it's going, and what it's doing.
Yeah. Awesome. Well, tap us again if you need help in Batavia.
Okay.
We're here.
Okay. Yeah, absolutely. That sounds great.
My only problem with the event is I did not win the suite tickets to the Buffalo Bills, which I really put a lot of money on.
Yeah,
I was like, it's my year.
Oh, that's a bummer. Yeah, that is a bummer. Fair enough.
It was a beautiful event. There were so many people. Yeah. It was great to see the support. Yeah. And it's fun to know, and impactful to know that events like that, it's going back to the people who you go to the grocery store with. Like, they could be fighting something that you're not aware of, and that could be supporting that person.
Absolutely.
I think that's wonderful. Now, you talked about partnering with some other organizations like University of Rochester. Last episode, we had on Dr. Megan Underhill, who's an assistant professor at the University of Rochester School of Nursing, a practitioner at Wilmot Cancer Institute, and also my niece. So, we loved hearing from her perspective. Tell us about, your perspective of working with organizations like U of R.
Yeah. Something that we often say, Meredith, my coworker, often says, it takes a community to serve a community. And I think we very much believe in, really the wealth of resources that are in our community. Wilmot at the University of Rochester Medical Center, and also Lipson at Rochester Regional, Roswell. I think having the ability to have really strong working relationships with them, where our programs department knows a lot of the surgeons or the providers, or they themselves went to them for their own treatment, and then just the huge list of resources that they have, from anything from, whatever their needs really are. There's a list for that. I think that we are a resource. We're there whenever you need us. And when it comes to places, I work closely with the community, or we work closely with the Community Outreach and Engagement Office at Wilmot. And, they just recently became NCI designated, which was super exciting. So I think for us, we do look at it as a very collaborative opportunity. And we're really grateful for the rapport and the ability to have open communication, and it's a team effort to support our survivor community. And I think we can all do our part in different ways. And sure, there's overlap, and I think that's a beautiful thing, to be able to be a place that's so rich in resources, because at the end of the day, you just want to offer whatever you can to someone who's going through this.
Yeah, absolutely. And one thing we talked about with the NCI distinction is that it's bringing providers into our area, and allowing enriched training opportunities. So the care back to the patients is just going to continue to evolve and get that much, like a more enriched environment and like care provider community available to them. So I can see where like Breast Cancer Coalition being able to tap into those continued expansion of resources will be really, really beneficial to the community that you serve.
Absolutely. I think, we're very fortunate to be in this area, and, so happy for for Wilmot becoming a designated cancer institute. It's very cool.
That's awesome. I worked at Roswell for a little while.
Did you?
I did. Yeah, I was in their IT department, and I was over meaningful use. So that was a 32 Medicare measures, which were put into place. Like if you go to the doctor, if they ask you if you smoke, that was one of the meaningful use measures. And walking through the lobby to get to my office, it was the chemo waiting area.
Oh, okay.
And so I like to say that changed me by every morning having to walk through and see these little kids who were sitting there waiting, or the woman who's there's one woman in particular, I can still see her when I close my eyes. Was probably my age at the time. She did not have any hair left, but had a beautiful pink hat on, and it was just like she looked so beautiful, but she probably was hurting at when she left that building. So I know Roswell also does really great things in the community.
Yes, they do, and they are very involved in our. A few of the researchers are very involved in our research initiative. Dr. Gokul Das is incredible. He's been on our research advisory board for many years. He's always a part of our research review day. He's been a research award recipient in the past. And so it's incredible what he does and what they do as well. We're just, it's amazing.
That is awesome. Yeah. And it's so nice to hear that everybody works together. Like the patient's the focal point, and that's just amazing to hear.
Yes. I think, it really, especially when I was more in the community outreach area, you go to these events and you see the same faces again and again, and you get to develop working relationships with people, and then be able to just send a quick email. I've got this question, and I'm not sure this or that, or do you know someone? And it's a wonderful thing to work together to support a community.
Amazing. Awesome. All right. So I know one of your pillars is advocacy.
Yes.
Tell us about advocacy, some things that you have going on for patient care, cancer research. So share a little bit about the advocacy pillar.
Absolutely. Again, so it's anywhere from local, state, federal legislation. Back in the day, I think this is the 20th anniversary in Monroe County, the Breast Cancer Coalition, so definitely Holly Anderson and others, Pat Battaglia, they were very involved in getting the 48-hour neighbor notification law passed, which is to give a 48-hour window for your neighbors to know that you'll be spraying your lawn with pesticides, in terms of pesticides having a potential link to cancer, for example. So this has been work that's been going on for a really long time. At the state level right now, we are really trying to support the Beauty Justice Act, which basically is looking at our personal care products and cosmetics, and trying to have those chemicals removed that are toxic, specifically endocrine disrupting chemicals, which a lot of I think it's about 70% of breast cancers are hormone positive. So if there's a hormone component, specifically estrogen, endocrine disrupting chemicals can really interfere with how those hormones are processed in the body, and there's links to hormone-based cancers like breast, ovarian, thyroid, prostate, and so on. So it's really looking at, I think on average the average person uses 12 products a day. Personal care products every day. So it's just really looking at from the environmental exposures and those links to cancer. So that's a big one that we are hoping to see passed. Similarly, there's a bill right now on labeling toxins in hair relaxers. So there are lots of dangerous chemicals in those. So just that's another bill that we're very passionate about supporting. On the federal level, the Metastatic Breast Cancer Access to Care Act is something that this is now, I think, the 7th year, I believe. So I think it's maybe the 4th congressional session that we have been very much advocating for the passage of. So I'd love to share that a little bit of information about that.
Yeah.
As it stands right now, when someone under the age of 65 is diagnosed with metastatic breast cancer, the vast majority of whom are women, and they reach the point of disability where they can no longer work due to their disease progression or treatment, they have a 5-month wait period for Social Security disability insurance to begin, and then a subsequent 24-month wait period for Medicare to begin. And in the meantime, they have often lost their health insurance because it's tied to their work. They might have been carrying the health insurance for their families, so they now have to pay out of pocket or, really high COBRA costs, a couple $1,000s a month potentially, or more than $1,000 a month, to ensure that they can have these treatments that are extending their life. Someone with metastatic breast cancer, that's considered a stage 4 terminal disease. Luckily, there have been, treatment. There's been progress, of course, in treatments, but unfortunately, the average life expectancy with that diagnosis is around 3 years. So potentially, or it has happened where folks, unfortunately, they die before they become eligible for these benefits, or they've faced bankruptcy, and, these could be women of any age under 65. This legislation would waive those waiting periods so that they could start at the point of reaching disability, have that coverage on day one. And it has been waived for diseases like ALS and end-stage renal disease. So that is a big one that we are advocating for. And, many of these women, are older and have been working for many years and have been paying into the system for their Medicare. So it's really something that everyone has been paying into. So just asking for those wait periods to be waived so that they have the financial means to continue the treatment that will extend their time with their loved ones. And
and no person should have to be in that situation. You look at it, and to your point, we do pay into a system for our entire lives, from job one, in a time of need, when you need it the most, it should be available.
Yeah, so that's one that we're very much advocating for. And we have a really wonderful program that Holly Anderson actually started called the Emerging Leaders Program, which is specific for young survivors of breast cancer who are getting involved in advocacy and research. And I was fortunate enough to join the cohort. I'm not an emerging leader, of course, myself, but we just went to Washington, D.C. earlier this month, and we were able to be a part of the National Breast Cancer Coalition's Advocate Leadership Summit. We're not affiliated with the organization, but we are a member organization, and our priorities align very closely. It was very, very, very cool to be able to go on the Hill and to speak with our representatives. It's a very bipartisan effort in really looking how can we support our survivor community. Again, particularly breast cancer, it's 1 in 8 women. I think in gynecologic cancer, it's closer to like 1 in 80. These are diseases that affect so many, and it was extremely it was amazing to see the survivor advocates sharing their stories, why this is so important to their legislators, and really asking for continued support, continued funding of research, and for continued funding of programs to ensure if someone doesn't have insurance, they can have temporary Medicaid when they are diagnosed when they get a breast or gynecologic cancer, cervical cancer diagnosis, from a screening, that they could have health insurance. That's a specific Medicaid state program. So there's just a lot that it was really, really wonderful to witness our survivor advocates being able to share their story and their power.
That's amazing. And I think it's great. So you actually, if I'm correct, you travel not only to DC, but I believe you guys will go to like Albany and just a lot of the, see live in action and get to talk to legislators.
Yes.
Right there, like in the heart of it when these bills are up or laws are passing.
Yes. And I will acknowledge I'm newer to the game in terms of being a part of the advocacy committee and as a co-chair. But absolutely, we've gone to Albany in the summer months when our state representatives are in recess. We'll often make trips to, again, in our 27 counties and meet with our assembly members and our New York State Senate members, and really have the ability to share what's most important to our survivor community and to their constituents.
Yeah, that's great. Yeah. It's good to hear that you go right to the assemblymen and to those representing us from a state perspective.
Yes, and we're very fortunate to have extremely close working relationships with assembly members and Senate members, Assemblymember Harry Bronson, Assemblymember Josh Jensen, Senator Brooke, Assemblymember Mankdalo. I mean, there are just so many. And again, it's very much a bipartisan effort in supporting this community.
Yeah, that's amazing. That's so great to hear. Yeah. How can the community help? How can we get more involved? How can we support? I know you mentioned the events and a lot of your larger fundraisers, but how else can we help the Breast Cancer Coalition of Rochester?
Yeah, I think a big part of it is having conversations about what we do. I think that sometimes people may not know of the organization, and in some ways that's a relief in that they themselves haven't had to come to the coalition for services, but just spreading awareness, spreading information about our organization and what we do with your friends, families, loved ones, so that if the time is of need for services, they have a place to turn. There are opportunities to get involved on our advocacy committee or on our research committee, get involved in different committees in general at the organization, become a volunteer. There are so many different ways to kind of be involved in an organization that does a lot of touch points on like an individual level, a community-based level, and then, definitely in the advocacy, we really go more on a macro level. Yeah. Follow us on social media. We're on Facebook, we're on Instagram, we're on LinkedIn, X, Blue Sky, all the things. And it's really great to have a strong following and to have engagement on those posts. That really does help as well. Mm-hmm. Reach out to us. And certainly, of course, we are always grateful for any donation, for any fundraiser, and that can be, collecting spare change over the course of a month. It can be, selling T-shirts. It can be, whatever it might be. Any support, again, is making a big impact because it is right in the heart of our community. And when it comes to fundraisers in the community, it's a large part of our annual budget. We certainly wouldn't be able to do what we do without that support. So I think, if anyone is interested, please reach out to our phone number. I can say if that's okay. Yeah. 585-473-8177. Email us at info@bccr.org. Whatever you need, we are there for you. And
that's awesome. We'll put all of the links and the info in the show notes as well.
Okay.
And we'll distribute that out along with the podcast episode.
Okay.
And again, I just, I think it's so important to just keep addressing the fact that everything you guys do, it stays right here in our community. And I there's not a lot of organizations that can say that. There's a lot of different groups, but I think the fact that what happens and what's raised, and the voices are coming from our Western New York community.
Yes.
And that's just so special.
Yes, I agree. And, I think in particular, we are so passionate about empowering survivors so that they have a voice at the table, a seat at the table. Even in our research initiative, one last thing, if I may, is that a survivor advocate will also review and be a part of the decision-making process right alongside a scientific reviewer. And they have a vote at what gets funded for this research that has a potential to go on for national level funding and to clinical trials. I mean, these small seed grants really go a really big way. So every step of the way, our survivor community is engaged, and we listen to them and we learn from them every day.
Yeah, that's amazing. Yeah. That is so great. It's such a great organization. I'm glad we could bring it here and let others across the globe know about the work that's being done here in Western New York, and the advocacy and the support that are out there for breast cancer survivors and patients.
I can't thank you enough. This is really wonderful.
Awesome. Well, I'm going to ask you one big question.
Okay. Yes.
I got two big questions.
Okay.
We'll start with one.
Okay.
All right. So global audience, 30 countries.
Amazing. So cool.
What's one thing you really want the world to know about the Breast Cancer Coalition?
Yeah. I think it is a safe space. It's a brave space. It's a place for people to find comfort and support. Survivors are at the heart of what of the work that we do is in supporting them. We have tons of resources, educational resources as well, supportive resources. But I think at the end of the day, we're looking to support someone, a community that is going through, a huge life disrupting event in the midst of living their lives, in the midst of this world, and I think at the heart of it, we're here, we're available, and it's a lot of hope too. And I think, I think just being present is something that I would want, I guess, the world to know is that we're a determined, small but mighty team, and we will do everything we can to offer that support and continue that.
I love the fact that you use the word hope.
Yeah,
I think that's beautiful. Wow. All right. How about one thing that you personally want to make sure you leave with the audience?
I don't know. I think back to my time at Harley, and it's a really wonderful thing to have opportunities academically, at Harley, and professionally. At the heart of it, I think I'm just doing the best I can every single day. I identify as a lifelong learner. I'm always curious and grateful for any opportunity to learn more, to be better, whatever that might mean. But, I do believe that I want to witness people in their truest forms, and whatever that might look like. I want to be there to hold space for people.
Yeah.
And I'm grateful that I get to do that every day at my job too.
Oh, that's so nice. Not many people can say that.
It's true. So I do feel very fortunate in that regard.
Yeah, absolutely. Yeah. I bet. Well, thank you for the work that you're doing.
Thank you so much.
Thank you.
Was an honor.
To everybody at the Breast Cancer Coalition. I know everybody works really hard, and it comes from such a good space and such heart to go out there and fight for those who are either newly diagnosed, currently fighting, or those who have been able to overcome. Yeah. So it's a wonderful thing that you're doing for our community.
Oh, well, thank you so much again. This was a true honor and powered by authenticity is pretty amazing. So.
Well, thank you. Producer Ken, thanks for being here tonight.
You got it.
And thank you for the introduction to Helena. I was like, oh, I didn't know that you worked for the Breast Cancer Coalition. That's so amazing.
Yeah. Thank you. Small world,
Yeah, that's so great.
Yeah.
Well, I want to thank everybody for listening to this third episode in our special series of our Western New York Changemakers. As you can hear, there are just amazing things that are happening here in Western New York that you may not be aware of. And now we want everybody around the world to understand that we're just such a special community and have some amazing people within it. I also want to thank GoArt, as we heard from Executive Director Greg Halleck in episode 1. This space is brought to us through a grant, and we are grateful every single day that we walk in here that we can use this beautiful space. So thank you to GoArt, and thanks if you're a new-time listener. Thanks for joining us. If you've been here a while, thank you so much. We appreciate your support. Helena, thank you so much for being here.
Thank you so much. It was a pleasure and an honor.
Thank you.